Thank you very much. I'm just honored to be a part of this important conversation today and to represent the committee that released, as you've heard last month, this important report on the national imperative to improve nursing home quality. And our subtitle, as you can see, is honoring our commitment to residents, families, and staff who really deserve to see major reform in care. Next. The next slide lists our committee members. I have the honor of chairing this committee, and I just really want to call your attention to the fact that on this slide you see names of many of our colleagues who have devoted their entire careers to improving the quality of nursing home care. And so quite a robust group, all very good to the work that I'll be sharing with you today. Next. So the statement of tasks that our committee was given is actually quite broad, and that was to examine how our nation delivers, regulates, finances, and measures the quality of nursing home care, and further to delineate a framework and general principles for improving the quality of care in nursing homes. We certainly were influenced by all that has happened because of the COVID-19 pandemic, but one of the key messages that we share with everyone about our report is that all of the problems in nursing homes that are reflected in our report existed long before COVID, and very importantly, all of these concerns will continue far after COVID unless our report recommendations are fully implemented. Next. So our committee's vision of nursing home quality is that residents of nursing home should receive care in an environment that honors their values and preferences, addresses goals of care, promotes equity, and the benefits and risks of treatment. And I would really call your attention, our 600-page report obviously has much more detail than I can cover today, but our first chapter presents what I think is an outstanding model of the vision of what quality nursing home care should be. Next. So in the interest of time, I'm going to jump to the report conclusions. There are very important conclusions, and the first is the one that I will mostly highlight, and that is that at the end of a year and a half of work in this area, weighing all the evidence, turning to experts, listening to family members and residents, our committee's first conclusion is that the way in which the United States finances, delivers care in nursing homes is ineffective, inefficient, fragmented, and unsustainable. The system is broken. And the additional recommendations call for immediate action, for fundamental change, for stakeholders to make a clear shared commitment to nursing home residents, to ensure that quality improvement don't exacerbate the disparities that exist. And our let's go into great detail about the inequities and disparities in nursing home care. Next. Our final conclusions are that high quality research is needed. The nursing home sector has suffered because of the underinvestment in ensuring the quality of care and accountability. And finally, that all relevant federal agencies need to be granted the authority and resources to implement the recommendation report. Next. So I'll briefly touch base on each of the key goals. Our goal, the first goal, is to deliver comprehensive, person-centered, equitable care that ensures residents' health, quality of life, and safety, and promotes autonomy and manages risks. And you'll see within each goal, there are specific recommendations. In this area of goal, we talk specifically about care planning, about models of care, about emergency preparedness, and the physical environment. Next. The second goal of our report, you've already heard reflected in the initial presentations today, we will never deliver high quality care unless we have a well-prepared, empowered, and appropriately compensated workforce. And our report recommendations talk about competitive wages and benefits, staffing standards and expertise, the empowerment of nursing assistants, education and training, data collection, and research. The next goal is the training
So Betty's frozen, and when she rejoins us, she'll continue. But goal 3 is to increase the transparency and accountability of finances, operations, and ownership, with the recommendations to collect, audit, and report detailed facility-level data. Data should be made publicly available and should be searchable in a manner that allows for assessment of quality by common owner or management company. Next slide. Betty, holler when you're back. We need to create a more rational, robust financing system. And the report said a study of a federal long-term care benefit should be conducted, looking at the adequacy of Medicaid payments, specific percentage of Medicare and Medicaid payments for direct value services, and value-based purchasing initiatives for long-term care. Demonstration projects on alternative payment models. The time is now. Next slide.
I'm back with you, Terry. Thank you.
Thank you. Pick it up at goal 5. Thanks, Betty.
Great. So our fifth goal is to design a more effective and responsive system of quality assurance. And within this goal, we talk about state surveys and CMS oversight, the long-term care ombudsman program, transparency and accountability, and certificate of need regulations and construction moratorium. Our sixth goal is to expand and enhance quality measurement and continuous quality improvement. And the recommendations within this section address measures of resident and family experience, enhancement and expansion of Care Compare, development and adoption of new measures, health equity strategy, and technical assistance for quality improvement. And the final goal is adopting health information technology in all nursing homes. Our recommendations in this area include pathways to provide financial incentives for EHR adoption, measures of adoption and interoperability, perceptions of HIT usability, and training in core competencies. And I'll just emphasize that in our committee, we had a lot of discussion about how the experience of residents of nursing homes could have been so much different during COVID if we had these recommendations in place, particularly when it came for the possibilities that technology could have enhanced care, and certainly in terms of safety issues, which were just abhorrent, as you all know. So in the interest of time, I just want to summarize that as I was thinking about this meeting today and talking about the particular issues of residents of nursing homes with Alzheimer's and related dementias, I think you could take all of our report and all of our recommendations and just amplify it and say everything that we've said about the quality of nursing home care is even more important in this group of residents. So our implications of the report for meeting the needs of these patients, I think, should even be more urgent. I will add that since the release of our report last month, we've had the opportunity to present to several congressional committees, to interact with, a great deal of media, with the public, and with people at all levels of policy. And we've had nothing but the most favorable response. And so the time is now. The time is now to act, to implement these recommendations. In our report, because it is so huge and there's so many recommendations, we actually prioritized. We've tried to identify which recommendations can be put into place now, immediately. Obviously, some of our recommendations, particularly as they relate to finance and reimbursement, will require additional study and planning for full implementation. But the committee stands behind every recommendation, and we believe that our recommendations are urgently needed to improve care for all residents. We also believe that every recommendation is absolutely realistic, and the work should begin now. So we thank you for the opportunity to be a part of today's very important discussion, and I'll move on to our next panelist. Thank you.